why don't you give me some examples of how technology is changing real world data application and use?
Yeah, so I view technology as one of the most important trends in real world data evidence for collection, analysis, and use. So, from one thing I mentioned earlier is that development of networks, again, networks of specialists who are most likely to record outcomes, but also integrated delivery systems, and in creating automated ways to connect to EMRs creates this new paradigm. The second is um, leveraging unstructured data, and think that the same seismic shift we're seeing in moving from Google to ChatGPT, we're seeing in going from natural language processing to large language-based medical language processing, and validated, repeatable use of clinical narratives and reports will become the norm. In terms of analysis, we had talked about technology like artificial intelligence enabling us to extract more from clinical records and even to make estimations. And then in terms of use, uh, leveraging AI for personalized medicine is going to be a big area. Um, and I think that uh, we also want to see technology used to bring those capabilities back to patients, not only in provider settings, but at home and in telehealth and other settings as well.
Can you draw a picture for me and the listeners of what that might look like at the patient's bedside with this predictive pathways and based on the artificial intelligence of large databases? How is it going to be used by the doctor and with the patient?
So we see two use cases emerging right now that I think won't surprise you. So one use case is really the website, right? So that a patient can go to an internet-based site, whether that's in kind of a chat format or enter a little bit of data format, um, as people try to take control of their own healthcare and enter some information about themselves or give permission for a system to obtain their medical record and get very specific information, like I described in Joint Insights, as to what their likelihood is to benefit or have risk from a specific procedure or treatment. And we're doing this in like rheumatoid arthritis, where we can identify for a specific patient their likelihood of improving if they're treated with a certain class of drugs versus other classes of drugs, and it differs by their history and their subtypes and other characteristics. So that's one way. The second way, which actually I think is a harder path, is actually getting clinicians to implement it. So clinicians are slow to change their workflow, but there you can think of it like ordering a test, where the way you obtain the information as a clinician is you basically complete an order form within your EMR, and the system scoops the patient's record, the key variables from the patient's record, and returns through an API a result back into that EMR. And so we're doing that in some of these programs as well. And again, having the information both to the clinician at the point of care, as well as being archived in the record, are key. But we really do like the fact that we can get the information to the patient as well, so they can use that as more of a shared decision-making model. That's how we see it being implemented.
And what are the physicians saying to you in your network? Love it. It's okay. How much trouble?
First thing, yeah, it's a great question. So the first thing is like a little bit of shock and awe that it's possible. Mm-hmm. And then the second question is, how do I implement this in my workflow? So like, how do I really like this. I really want to do this. I want my patients to have this. How do I implement this in my workflow? And that's like the hard part of getting it to work through workflow, that you almost have to go through use case by use case in some cases.
And that's a whole different division of a company too, I would think.
Right, exactly.
Well,
we
Rich,
work with partners. Yeah.
Oh, that's good. Yes.
Yeah.
Well, Rich, I want to thank you. It's always just such an honor and a pleasure to have a chance to sit down with you. I learned so much.